Welcome to the AA Podcast, our little corner of the web where we are not afraid to discuss tough questions like,
when did nutrition, health, movement, and stress management become alternative medicine?
Where we embrace challenges in all aspects of life to become healthier and stronger versions of ourselves.
And where food and movement are the best kinds of medicine, and cooking meals at home is a revolutionary act.
Hello, and welcome back to another episode of the AA Podcast. This is Ashley Olson.
And I'm Andrea Crane.
We are coming back with part 2 of our series on oral health. So if you have not caught the first episode, scroll back just one and take a listen at last week's episode. We kind of talk about what oral health is, why it's important, and why it's not just about having fresh breath and white teeth. So definitely take a listen to that. But before we get into this week's episode, as always, we're going to share our weekly Bible verse. And mine is coming from Matthew 15:11. And it says, "It is not what goes into the mouth that defiles a person, but what comes out of the mouth. This defiles a person."
Oh, that's awesome. Okay, and mine is from the ever-wise Proverbs 18:7. "The mouths of fools are their undoing, and their lips are a snare to their very lives." It's kind
So
of
good.
I know. I know. I always found the Psalms or the Proverbs. I mean, yeah.
Yeah. So in this week's episode, we are going to be focusing more so on the interventions of maybe poor oral health, if you will. So, Andrea, where do you want to start on some interventions and maybe what the interventions are for?
Well, I think the first place we should start is with just with the basic cavity, right? Because that's kind of where the dental undoing begins to occur, is with these kind of run-of-the-mill cavities. And cavities are caused predominantly, almost exclusively, by a strain of bacteria called Streptococcus mutans. And this bacteria is in your mouth. And as I mentioned in the previous podcast episode, this is spread from person to person. So yes, kissing can get you cavities. So yeah.
So when you're doing your dating profile,
that's right.
Yes.
So when your mama said don't marry a man without a dental plan, this is probably what she was talking about. So
and don't just go kiss some rando.
That's right.
So with it, not just kissing, but like sharing drinks.
Well, that I'm uncertain about. I don't know. I don't know what the depth of the exposure needs to be.
Because I know I'm pretty positive you can share like cold sores. That virus with
for sure.
Sharing drinks. So it wouldn't be too far-fetched to say.
It wouldn't. And I don't know. I don't know what the exposure, like, how vigorous does the exposure need to be? That I don't know. The herpes virus is pretty resilient, and that can be spread. Those cold sores, man, they get spread from Aunt Sadie to little Johnny so fast. Kissing that little baby's face.
Yuck.
Yeah, it's rough. But yeah, so just be careful who you kiss. That's all.
Yep.
Okay. Now here is the big news flash on these things. They can be reversed. And so people in functional medicine circles have been saying this for a long time. And in fact, I will give credit where it's due. The Weston A. Pricers have been saying this for longer than probably functional medicine has been around. So in fact, Weston Price was a dentist. And so, this is common knowledge in certain circles, but not really accepted or acknowledged by mainstream dentistry. But here's the caveat. All right. So you've got this nice enamel that fits over your teeth. So it's the dentin underneath the actual white part, not the clear part. The clear part is the enamel. The white part is the dentin. If the cavity makes it through your enamel and is into the dentin, then you really can't remineralize those. The data is less clear. So, can you remineralize an initial like baby cavity? Yes, you absolutely can, and you absolutely should try.
Hmm.
So, yeah, those can the ones that are just through the enamel can be remineralized. And so
And is that through the hydroxyapatite, or are you going to get
sure.
into that?
Sure, it's absolutely through hydroxyapatite, and there are some folks that would say that painting on fluoride, like they do on children's teeth, that would also contribute to remineralization because you're inserting fluoride where calcium is generally. Um,
Mm.
so yeah, but I would say go to, and we'll do a recap of all of the like good steps to good oral hygiene. We'll do a recap of those at the end. And really, that's what we're talking about when we're talking about remineralization. And so, just being really fastidious with your dental habits can remineralize the initial insult of a cavity.
Okay.
Yeah, so don't eat a bunch of Jolly Ranchers and go to bed. Like, that's
Yeah.
yeah, and not brush your teeth. Actually, don't eat Jolly Ranchers at all. Anyway, yeah, yeah, I mean, yeah,
Oh.
they're just don't do the stupid stuff. You've gotta be really fastidious with your routine.
Okay. How does is there knowledge on how long that typically takes, the
That's
remineralization?
That's a great question, and I think that would be very individual.
Yeah.
I would like if I were remineralizing a cavity, and I've done this on several occasions. Um, I I usually go into like a brushing 3 times a day mode. I'm super fastidious with and this is when they so I want to be really clear here, guys. This is when they go around with the cleaner, right? With the little pick at the dentist office and it kind of sticks. It's not like jammed into your tooth. It's just
Yeah.
that little initial bit of sticking. So it's not like a through and through cavity, right?
Right.
And so yeah, I've absolutely done this. And you just want to make sure that you are not leaving anything to sit on your teeth that is carbohydrate based for any period of time.
Yeah. Okay. That makes sense.
Yeah.
So, let's talk about fillings.
Oh, yeah. Yeah, so so some of the more conventional remedies that we have for dealing with cavities, I mean, honestly, it's just drill your teeth out and then fill it with something. That
Hmm.
is that is the only remedy that we have. And in, I don't know, 100 years of dentistry science, like that's the best that we still have. Um,
Yep.
it's pretty, it's honestly, it's pretty prehistoric. Yeah, we definitely should have better solutions to this, but we don't yet. So, they essentially drill out an area of healthy tooth and they fill it with a supposedly inert ingredient. We used to fill these things with mercury.
Mm.
So, which is, what could go
Yeah.
wrong? Um,
Right. Just some
yeah,
little drips of mercury
yeah,
poisoning over
it's fine.
time. It's fine.
It's fine.
No,
Um,
actually, pretty much all my relatives that had the mercury, they've all had them replaced now with,
yes,
is it enamel or not enamel? It's with
like a porcelain.
a porcelain. Yes,
Mhm.
sorry.
Yeah.
And the difference that they felt
Mm,
after
mhm.
was significant.
Yeah. Yeah, well, and so see this gosh, this is just yet another example of where we can't have too much hubris and faith in our knowledge, right? We've got to continue to question things, and we have to
Mhm.
continue to be allowed to question things, because that was settled science. Mercury was settled science. It's fine. You're crazy. You don't need to have these things out.
Yeah.
Um, but now we know better, right? Because
Mhm.
people kept asking the question. And so anyway, so we don't do fillings with mercury amalgam anymore, which is great. And now we use more inert ingredients. We actually used to use gold, but that is,
Kind of
it's,
expensive.
it's kind of expensive. It's a softer metal. Like, yeah, there are things that are not great about gold either. And you can have gold allergies, and any kind of
Mm.
metals that has access to your bloodstream, to your mouth oral microbiota. Like, I would think that that's probably not good over time. And as well, when you have these mercury fillings removed, and we'll discuss this, a few aspects of this a little later, but you want to make sure that you are going to the right person, because I know, personally, people that have had these things out, by people who have not been trained in the proper removal of a hazardous substance. Like, in order to have these properly removed, people have to walk into the room in bunny suits. And I
Mm.
mean, like, the biohazard bunny suits, because you are literally removing a reactive compound from somebody's mouth. And just in drilling it out, you're releasing things into the air. So the patient has to be very well protected, and the people who are doing the work have to be very protected too. So it's a whole body of dental science that goes into this. So you want to make sure that you're going to the right person who is trained and knows how to do this safely. Okay.
Okay.
Um,
Yep.
Now the other thing I wanted to talk about is having um, let's see, if you do have a cavity and you need to have it filled, I think it pays to do some research, because they're making compounds now, like these composite resins, out of glass or even plastic. I wouldn't
Hmm.
necessarily want plastic in my mouth. I know that
Seems very
oh
porous.
my gosh. Well, we're completely full of microplastics now, because
Yeah.
they're in our environment, they're in our water, they're in all the plastic containers of drinking water, like, they're everywhere. But here's the problem with these fillings, and this is the huge problem with metal fillings. It's because your teeth, when you chew, you generate so many pounds per square inch of pressure. Like, the human jaw is really strong. And
Mm.
so you're essentially grinding and pressing on this metal, and you are releasing parts of it. Like, as you're grinding your teeth and chewing, you're actually getting down into it. And I would think that something that, even a composite resin of plastic, is probably still releasing some particulate as
Yeah.
you're chewing. So glass, I would think, it's just silica. Glass is silica, compressed silica. And so I would think that glass is probably the most inert of all of the ingredients for a resin. So yeah, maybe glass is the best option there, but I would certainly do some research in that.
Yeah. Good call. I didn't even have a clue that they were using those. So
Yeah.
yeah. So root canals.
Oh boy. Huh.
Yeah, I feel like there's some talk about, like, do you actually need a root canal?
Yeah.
What kind of what makes it when you're like absolutely you have to have one?
Mhm.
What's going on there?
Well, so here's what I want to say. There is never a time where you absolutely have to have a root canal. Now, I want to preface that that does not mean that something doesn't need to happen, but
Mm-hmm.
it doesn't have to be a root canal. So there have been problems with root canals forever.
Yeah.
Essentially what they do is they go in and they dig out, so they drill out your healthy tooth. Well, it's not a healthy tooth if you're getting a root canal, but there is still, non-necrosed tissue left. So they drill
Right.
all of that out of your tooth, and then they go down and they drill out into that alveolar bone, and they drill that out to get the root of the tooth out. So where your tooth attaches to the jaw, um,
Mm-hmm.
they take that out. Now the problem with that is that there is oh gosh, your mouth is so full of bacteria that it's almost impossible to do that without introducing bacteria into the site.
Right.
It's kind of like having a joint surgery, right? Like having a shoulder surgery, it's really, really hard to not introduce any bacteria into the site. That's one of the major issues with shoulder surgery, is because it's so close to the axilla or the armpit. There's lots of bacteria that live right there, and so anyway, it's difficult. We've got a environment in the mouth that's just teeming with bacteria, and then you're doing this big drilling process, and so then you're packing it full of, hopefully, again, inert packing material, and then you're kind of sealing it off. Well,
Mm-hmm.
a lot of people's experience has been that there are these little festering infections in there, and I can't tell you how many people that I have read about and experienced personally with patients, where they have had root canals, and then for the next, I don't know, 5, 10, 15 years, they've had these nagging symptoms that they just can't get rid of. And, a lot of times they're systemic and they're pretty nebulous. And it's like, well, this could be from this or from that. It could be really from anything. And then they kind of, they do some reading, they do some research. Their practitioner tells them, hey, let's look into this. They get the root canal reversed and all their symptoms go away.
So what does that mean? I've never had a root canal.
Okay.
What do you mean, like what do you mean by reversing a root
Yeah,
canal?
and I don't mean that you can go back to the starting place, because you can't. Essentially, all you can do is have the tooth pulled. That's it. That's the only that's the only recourse. So once you've had a root canal, and I will also tell people this. So when I said there's never a circumstance where you have to have a root canal, the reason you do a root canal is to save the outer shell of the tooth
Mm-hmm.
so that it's still standing there, one, for cosmetic purposes, but two, also for the structure of the jaw. The alveolar bone is pliable, and it will start to crowd some teeth. I think reports of this are a little overblown in
Mm.
certain circles, like how bad and how fast the crowding happens, if it does happen. But essentially, you have two choices once that tooth is compromised, to the point where you need a root canal. You can either have the tooth pulled, or you can have a root canal.
Okay.
Period. That's your choice.
So there's no like, well, let's pack it with whatever
Nope.
and get the infection out. Like
Nope.
it's either nope, you need that tooth out.
Yeah. Yeah. Yeah, because, that and have people have root canals redone? Yes, I think that is a thing. I do think that, you can do a CT scan of somebody's jaw and see pockets of infection. And so, can modern dentistry go in there and redo the root canal? Yes, I believe they can. But you still may have, how do you get every single bacteria?
Mm-hmm.
It's just, and then, they of course double and double and double. And so you're right back where you started within a, who knows what period of time, but you're not getting rid of the source of infection. It's almost impossible. So yeah, often I would say, I mean, unless it's oh, this is such a tough situation, but and this kind of leads us into implants. So that's the next
Mm-hmm.
topic that we're going to dive into here, because when I said, okay, you got two choices, you can either do a root canal or you can have the tooth extracted. Well, then once you have a tooth extracted, then you have two choices. One, you can leave it be and just live with it, or two, you can have an implant, and that
Mm.
is an implanted tooth into that kind of it's, gosh, it's very mechanical looking, right? So they place a knob where your tooth used to be, and then they make a crown that goes on top of that, and it's just metal on metal, and the crown looks like the tooth that you used to have, and they
Hmm.
put it down on top of it, and it looks just like your teeth used to look. And
Yep.
it's a beautiful solution if it works.
Right.
Yeah, but, um, more frequently than people probably know, they fail.
Yeah. They're constantly falling out, or
Yeah.
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 And so that's a problem. Once they fail, then a lot of times what happens is you have to, like, they have to go in, and via x-ray they can look and see, well, do you have enough bone there in your jaw to sustain another implant in that spot. So once an implant has failed, obviously they have to get it out of there. They have to get the little nub out of there as well. Then you have to heal, and then they can look and say, well, you don't have enough bone tissue there to support a second implant, so now we have to do a bone graft.
Mm.
And so, yeah, there it's just intervention after intervention after intervention. And so I would submit, this is not going to be a popular opinion, but honestly, what I have advised a lot of people to do, and I have taken this advice myself, is that if you have a tooth and it's in the back of your mouth and it's not aesthetically visible, just have it removed.
Yeah.
So, yeah, and then, the problems are over. And yeah, you can talk about the crowding and the teeth moving and all of that. I've not experienced that. I had an implant fail. I had an injury to a tooth because of chewing ice when I was in college, and that led to just a host of events. I've had just about everything you can possibly imagine happen to that tooth. And finally, it was just like, I can't do this anymore. I had a bone graft. I had an implant. Did I have 2 implants? I believe it was 2 implants that both failed. And yeah, then I was just done. It was like, you can't see it, and I don't care. I cannot go through this anymore. And
Yeah. I
so,
had no idea.
yeah. So it's been probably, gosh, I bet it's been 15 years
Okay.
since all of that, and I've never had a problem since. My teeth have not shifted. So, yeah.
Yeah. You have a note here about zirconium.
Oh my goodness. Okay, so if you're going to get an implant, and this is kind of where I was gonna go, if I was going to get another implant, and if, God forbid, if I had another injury to one of my teeth and I lost it, and it was in a really prominent position in my mouth, would I get an implant? Yes, I would. I would.
Yeah.
And oh gosh, we could talk about bridges too. Actually, let's talk about bridges after this. So, implant, yeah, so once you get the tooth out, I misspoke. You can either get a bridge or you can get an implant. So I want to talk about bridges. Um, so the implant material that is used. Now, I have heard, I did quite a bit of research on this when I was thinking about getting yet another implant, because it had failed. Um, Zirconium, and this is straight from, like, the functional dentist people that I would listen to and read, that zirconium is the most inert ingredient that you can use to make an implant. Now, the problem is that none of these great things are covered by insurance, and so,
Of course not.
yeah, of course not. Why would they be? So yeah, it's quite expensive to get a zirconium implant, but I imagine prices are probably down. But yeah, apparently that is a a promising a promising bit of dental development is zirconium implants. So
Okay.
look for those. Now, I want to also talk about the possibility of a bridge. So, when I first lost that tooth, again, had the injury, lots of terrible things happened, and then finally I just lost the tooth, because after a root canal, they didn't pack it, and it was just a mess. So, lost the tooth, and, implants weren't really a thing at that time, and so, I had gotten a something called a Maryland bridge. So, again, my dental history, I have never had a full cavity. So, they didn't want to, because if you get a regular bridge today, they will file down the perfect teeth on either side of where you need that bridge, and
Mm.
they will stick that bridge on top. It's like they make caps for each of the teeth on either side of where the hole is. And so
Wow.
they'll file down perfectly beautiful teeth. Well, fortunately, this happened to me long enough ago that they were still doing something called a Maryland bridge. And
Okay.
this is a type of bridge where they would do minimal filing on either side. In fact, it was very little filing at all. And they just glued with dental glue, they glued the bridge to the tooth on either side of where the hole is. And so it was
Okay.
a glued in bridge, but mine lasted for years until it fell out. And then I went down the implant road. And now you can't find a Maryland bridge. They don't do them anymore, which
Huh.
I find is terrible because, any of the bridges that they do now, they completely destroy the teeth on either side of where the hole is. So essentially, you don't have one tooth compromised now, you have three.
Right.
Yeah. So that's problematic. But anyway, that's my rant on bridges. I think I I just think we need better technology. It's ridiculous. I'm sorry, can you hear my dog? Oh.
Yeah, but it's
Oh
okay.
my gosh. Okay. Yeah, so I just think we need a revolution in dentistry. Uh,
It's one of those things that obviously everybody has and needs.
mhm.
We all have mouths, I'm
Right.
pretty sure.
Yep.
And so, but it seems like it's been one of the least advancing in
Yeah,
technology.
yeah, and you know what? I don't claim to have much knowledge about dentistry. It's not in my wheelhouse. It's not anything that I have studied formally. But I do know what the options are and what's available to normal people. Now, there might be some options that are outrageously expensive available to people that have, insane amounts of discretionary income, but that's not me and that's not most people. And
Right.
so in my mind, unless it's available to broad swaths of the population, it's not really available. So,
Right.
so
Yeah.
yeah.
So let's talk about mouthwashes.
Oh, yes. Okay. Mouthwashes. This this is a huge problem. So there people are probably familiar with, when you get your dental cleaning and they check the gaps, right, between your
Hmm.
gum and your tooth, and they'll measure those. And
Yes.
so there used to be a prescription only mouthwash, and I am was it chlor anyway, I'm completely drawing a blank on what the brand name of this stuff was, but it came in several different flavors. And I remember people would come into the pharmacy and they get to pick what flavor of mouthwash we filled it with. And anyway, it was just super like novel. This weird prescription mouthwash. And so anyway, the active ingredient in it is chlorhexidine. So chlorhexidine gluconate, for those not in the know, this is a surgical scrub. So this is what they use to scrub you before surgery. So it kills absolutely everything. It's like an atom bomb to your oral microbiome. So you swish and spit with this stuff and it is just killing everything. And that's why it was prescription only, but guess what? It's over the counter now. So, yeah, you can get chlorhexidine mouthwash that is over the counter now. So that's a problem because we have good bugs in
Yep.
our oral microbiome that we want to protect. And so chlorhexidine, no go. But then you've also got these mouthwashes that like Listerine or Scope or any of the ones that, you put them in your mouth, there is something going on because it feels like your mouth is on fire instead of your
Yes.
face, right? And so you hold it in there for as long as you can, and then finally, you can let it out of your mouth, and your mouth is left just like tingly and like something just happened in there. Okay. Well,
Mhm.
something did just happen. You rinsed with an alcohol based rinse mouthwash. And that also, it's like putting rubbing alcohol on things. Again, surgical prep, right? Like
Right.
alcohol kills bacteria. And so, yeah. So those alcohol-based mouthwashes, those are not great. They're not good for your microbiome, and they may freshen your breath temporarily. But man, good oral hygiene over the course of time, you don't need to worry about your breath.
Yeah, exactly. Mhm. So another thing that's kind of
Are
popular,
you
and I
writing
think
oil
it,
pulling up there?
yes, oil pulling.
Okay. Yes. Okay.
What
Yeah,
do
let's
you,
talk
what,
about it.
yeah.
What do you know about
So the only thing that I really know about it is, um, people claim that it kind of helps, I think, detox the mouth. I don't know if that's the right term, but or it pulls like toxins out. And you usually do it with like coconut oil. And
Uh-huh.
I think when I first kind of heard about it, it was like do it for, try to do it up to a minute. I've heard people doing it up to 30
Yeah,
minutes. Like
yeah.
it's all over the board. I don't honestly don't know any research that I've seen that
Mhm.
says that this is the way. But
Yeah.
yeah, what are your kind of
I
thoughts on that?
Okay, so first of all, I don't think there is any research. I
Yeah,
But that doesn't make it
not
any less
good.
valid, right?
Right, right, right.
So, yeah, so oil pulling, I don't know how old this practice is. I really don't have any idea. It could be very recent, like in the last, I don't know, few decades.
Hmm.
Or it could be very old. I don't know. But what I've heard about this for a long time now. The only so we don't have any information. We don't have any like studies to point to say, oh yeah, it does this or it does this. Um, so the only reason that this might make a little sense to me is with the use of an oil that I could see could actually do some good. So people talk about doing oil pulling with something like olive oil. Well, that doesn't make much sense to me. However, coconut oil makes some sense to me. And here's why. Coconut oil, if you've ever used coconut oil on your skin, a lot of people think that, oh, coconut oil, it'll be a great emollient for my skin. Then they find out it kind of dries their skin out. And why is
Mm,
that? Well, there's a compound in coconut oil that makes it amazing. And it's called lauric acid or monolaurin.
yeah.
Yeah, and this is an antimicrobial agent. And so, if you're talking about oil pulling in the mouth, coconut oil has this beautiful antimicrobial that's just in it. Yeah, I could see it doing some good. Now, that's not a completely indiscriminate killer of all things like
Right.
alcohol or chlorhexidine. And so yeah, I could definitely see some benefit there. Here's the problem I have with oil pulling. Well, one, the logistical problem of where do you get rid of this stuff? Because you can't spit it down your sink because you
Yeah.
don't want an oil that's solid at room temperature going down your sink. That's just a recipe for disaster. And you probably don't want any oil at all going down your sink, frankly. So there's that. And then two, you're right. People talk about, oh, you got to work up to 30 minutes a day. And it's like, I'm not doing this for 30 minutes.
Right.
I
Well,
I
although I would love to see somebody that has done it for like say
Sure.
10 years and know their bone structure. Like, do they have less wrinkles?
Yes. Okay. So one of my kids just told me there is a term for that where you do these exercises and it's supposed to like
Face
snatch
yoga.
your jaw. No, no, no. It's something the kids are saying. And
Oh.
yeah, anyway, I forgot it. He's going to be so disappointed. I'm going to have to ask him again. But yeah, where you get that snatched jaw. Oh, I know what it is. It's mewing. So,
Mewing?
yes, there's like a signal that you can give, like, if somebody asks you a question, you can give them this hand signal, that literally means, like, "No, I can't answer you right now, bro, I'm mewing." Right, where you like, having that snatched jawline. I don't know, it's crazy, kids are crazy. But,
Okay.
yeah, I know, I know.
So you can look at these. I just posted them in our notes, but there were two studies about coconut oil specifically,
Okay.
and the um, reduction that it did show a reduction in some gingivitis.
Oh,
So
cool, cool. And like
um,
I said, that makes sense to me. Now, whether it was, and I don't know, let's see, p-value was less than 0.05. Okay, okay. So that's a statistically significant difference. Yeah, when is this study from? Oh, 2020. Okay, so that makes sense. That makes
yep.
sense. Real recent study. Yeah, and like I said, I'm sure if it's an ancient practice, I'm sure that there is some validity to it. If people have been
Hmm.
doing this for a very long time, there's a lot of wisdom in old practices that we just kind of poo-poo because we've got, our modern practices. So yeah,
Yeah.
I love that.
Awesome. Okay, so why don't we kind of review like some best practices
Okay.
for oral health?
All right. So first, we're going to start with the toothbrushing. This is going to be a bit of a recap from the last episode, but when we get to the end, I teased it last week. I'm going to tell you what to do about mouth breathing at night so you can save your oral health. So first of all, toothbrushing twice a day. The most important time to brush your teeth is before you go to bed. Why? Because saliva production is less at night. And if you want to know why, you'll have to listen to the previous episode. Ashley enlightens us all to why that happens. So thank you, Ashley.
Oh,
Um,
you're welcome.
the
Always
next
providing that little extra to each
I know.
episode.
You are the little extra, yes. So then there's the flossing. So flossing is awesome. Water pick is great. I don't have one. In fact, I
We used
don't
to
know.
have one as a kid. I
Oh, really?
loved that thing. Yes.
Wow. You know
It
what?
was like a power wash for your
Yeah.
mouth.
Maybe I'll ask for one for Christmas. Our birthday. Yeah, I have always kind of wanted to try one. I never have.
Yeah,
Always wanted
they're
to
I
try
liked them. I like them
one. Okay.
way better than flossing.
Huh, okay. Yeah, I might look into that. So yeah, water pick, great. But also flossing, I really, really dig these little plastic things, and I know we're contributing to
Plackers.
plastic. Yes, yes. So they're not super great for all the things that go in the garbage can, but I'll tell you they're so much easier than wrapping the floss around your fingers and trying to cram that thing in your mouth. And if you got I have a little mouth. I make a lot of big sounds, but I have a little mouth. And so it is really, really hard to cram both of my fingers in there, and I just can't. Yeah, anyway, regular floss is terrible for me. So I love the plackers because you can just, get in and get out of there. So those are great. And then also rinsing with water after you eat. So if you've had a meal that is heavy with carbohydrate and you want to do something extra, you can always rinse your mouth out. In fact, you probably get a few extra points for warm water, just because
Mm.
warm water will dissolve more readily things than cold water will. So rinse with warm water. And that will knock some carbohydrate off your teeth, which Streptococcus mutans uses as substrate for destroying your enamel. So
Mhm.
don't give it anything to eat. Now we're down to the mouth breathing. Okay, you guys. So if you mouth breathe at night, this is a terrible time. to breathe through your mouth because you're not creating as much saliva. Plus, when you expose your open mouth to the air, it completely dries out. And so that's when your oral health can really take a nosedive. So, what do we do about this? Because we're sleeping and, maybe you're congested, maybe who knows why you're open mouth breathing, but you are. So, how do we fix this? Well, first of all, if you're mouth breathing during the day, we need to go after things like allergies, congestion. Like, why are you doing this? Why does your body resort to open mouth breathing?
Mm-hmm.
And so I would, of course, always argue for the functional fix, right? Like, we would start with some mast cell stabilizers like quercetin and maybe some stinging nettle, stuff like that, for what's going on with allergies, but then also to, what are you being exposed to that's causing this congestion and how do we stop that? All right, so that's the big solution. But in the meantime, while we're trying to figure that stuff out, how do we stop mouth breathing at night? There is something called mouth taping. Have you ever heard of this, Ashley?
Yes. Uh-huh.
You have? Oh my gosh. Okay, well, I thought this was
I
gonna be a
think
surprise.
I think it's pretty popular right now.
Okay, yes, it is, it is. So mouth taping, I love this. I think it's great. You literally just put a piece of tape across your lips when you sleep, and there
They do actually make some
yes, they do.
specifically,
They do.
so
I know.
yes.
I know, but
Marketing.
I know, right? Yeah, somebody's gotta make a buck off of this. But yeah, if your skin can tolerate it, like if you've got super, super sensitive skin, you probably don't wanna put adhesive on your mouth, that isn't a little bit special. So you can either buy the very expensive, like, extra, mouth taping things, or you can just, like, put a small piece of tape over your lips. You don't have to tape your whole mouth shut, just like a little strip there. Um, that will just keep your mouth closed. And then in the night, your body will, it won't be able to open your mouth without a whole lot of effort. And so, yeah, you'll breathe through your nose. Now, if you are breathing through your mouth and you've got apnea, like all of those things need to be addressed. So,
Right, yeah.
yeah.
Go back to our sleep episode.
Yes, do that. Do
Yes.
that. All right. And so finally, last but not
Yeah.
least.
So if I'm looking for somebody that kind of is in line with where I want to
Mhm.
go with my oral health, like where do I go if you know,
Yeah.
if my typical dentist that I've always gone to since I was
Mhm.
12 is not
In line with the
interested?
things you're
Yeah.
asking about.
Yeah.
Yeah.
Hmm.
Yeah, so I would say first and foremost, um, try to find a certified biological dentist. That's what these folks are called. They're called biological dentists. When I was talking earlier about getting fillings removed the proper way with the bunny suits and all of the mitigation techniques that they learn, these are biological dentists who are trained in these techniques. They are respective and encouraging of functional measures. And so I would just encourage you to find a biological dentist. We'll put a link to a website where you can locate one in your area. And that is the first and foremost. You got any ideas?
Well, and we were talking a little off air, and I was like, it kind of feels like it would be very similar to finding a PCP, which we talk about that in a few episodes back, where if you want to find a primary health provider
Mhm.
that kind of is in line with the way that you want to be treated, it's honestly an interviewing
Right,
process,
exactly.
and so I feel like I don't know this. I've never had issues with my dentist in the past, but I feel like it could be a similar situation where you could interview and just
Mhm.
talk to certain dentists in your area that your insurance does cover, and
Right.
see if they are open to maybe doing things a little bit different, if you will.
Yeah.
Um, but yeah, I do know somebody here that has a biological dentist and absolutely loves it, and so
Mhm.
I'm very eager to when I'm ready to schedule my next appointment to potentially talk to them and see what that entails, because like you were saying, it's probably not going to be the cheapest route.
Right, right. Yeah.
So seeing what
Yeah,
that looks like.
but I can tell you, so I go to a regular dentist to have my cleanings done. Um, and I go about once every year or once every 2 years. That's just the schedule that I prefer, so that's what I do. Um,
Hmm.
and I end up usually finding a new dentist, almost every time because I don't like the harassment about, decisions that I've made about, I don't come twice a year. I've not had a problem with cavities and I'm not going to come twice a year.
Yeah.
And so, and I'm not mean about it, but I just am, it just doesn't seem to be received well, and so I just get weary of the conversations,
Hmm.
about what I don't want this or I do want this. So I have yet to find the perfect person, and I'm hoping that I will. But I can tell you, if I had to have anything major done, you better believe I would be looking for a biological dentist, and they would be the first place that I would go get an opinion on what needs to be done.
Yep. I'm excited to look at the list that the link that of the list and see who's in my area, and
Yeah.
talk to my friend too. But the one thing that like we both are kind of, one reason why we're kind of weary of always going to the dentist is they typically want to do the x-rays once a year. Thankfully, the dentist that I have had in the past, because I am very low risk, they only took mine every 3 years.
Oh, that's great. Yeah.
And so I didn't still love it, but at least it wasn't every year.
Yeah. Yeah, I
So
think that's great.
yeah. So I think too, just kind of like with your primary health care provider, like have conversations with these people. Like they're humans.
Yeah, yeah,
They are behind usually a masks, because
right.
they're dealing with a nasty part of your body.
Right.
But talk to them, and hopefully that they are open and willing to hear you and your concerns and why you might want to do things slightly differently
Yeah,
than normal.
yeah,
So
absolutely.
yeah, well, I hope these episodes were insightful and helpful to you as you kind of are maybe beginning or are in the midst of your oral health journey. And as always, please hit us up with any questions that you might have. Our contact information is in the show notes as always, and we will catch you on the next episode.
Bye-bye. The content provided in the AA podcast is intended for informational and educational purposes only. The podcast is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The information and opinions expressed in this podcast are solely those of the individuals involved and do not constitute medical advice.